welcome. What we're going to do today is a little bit of a follow-up of what we started doing previously. And so we're going to have a little post-op interview with one of our facelift patients, just so that people can hear a little bit more about what it's like to have a facelift. So this is our patient who had a facelift a couple months out now, right?
Remind us. December.
Yes, so it's currently late February. So your surgery was early December, wasn't it?
December 5th.
Right. And so tell us what brought you to see us in the first place.
Well, for many years, I'm talking probably a decade, I've felt that I'd like my face more or less ironed, like clothing. It's really kind of wrinkled and rumply looking. Well, that's how I felt my face was. And I knew that I was going to have to work probably for 10, 15, maybe even 20 years longer. And I wanted to remain competitive, even though I was older. I entered the job market very late in life after my children were grown. And I'm a professional. And so it's competitive with the type of profession I would want to enter into. Well, I wasn't able to for various reasons. And I've recently moved here to North Carolina. I come from Las Vegas, where the weather is brutal on one's skin. It is so dry and so much sun. And so I wasn't working. I retired. And I didn't think about it right away, but about 3 or 4 months in to living here in Winston-Salem, its little bugs started whispering in my ear that, hey, maybe it's time and maybe I can. So I started researching who I'd be comfortable with. And at any rate, you were among a few finalists, and I chose you, which I'm very pleased that I did.
Thank you.
Okay. I needed to find out how much it was going to be, how much downtime I would have. And everything seemed okay. The cost, of course, to me, it was a lot. However, having said that, it's been well worth it. I do not have buyer's remorse.
Great.
I may have a few days afterwards because of the swelling. I mean, we talked about that.
Right.
And another thing I was afraid of, the after part, was that I would look too young for my age. And I didn't want that either. I wanted just a natural, lightly ironed look.
Okay.
And I've achieved that. So I'm very pleased with that.
Perfect. Well, tell us a little bit about just that first couple of weeks. So you said you had some concerning days, but I oftentimes say one of the hardest parts is just the unknown. Like a lot of people, they've never gone through this before. And so I try to prepare them by talking to them, like at your consult and your pre-op appointment. But just tell us a little bit about that first week or so.
Going into the surgery, I had no worries about going in. I was not scared at all, except for maybe that day. But that's it, just for that brief little bit. And then I woke up and my head was thoroughly bandaged, and I was in pain. The pain afterwards, other than the first day, was a lot less than what I anticipated.
Perfect. Okay.
And the pain by probably the 5th or 6th day was just almost all gone.
Okay, great. Let's talk a little bit about timing. When do you feel like bruising and swelling had resolved to the point where you could go to the grocery store?
I would say just mid into the 3rd week.
Okay.
About the middle of the 3rd week.
You might say just past the 2-week mark.
Right. Correct.
And 2 weeks is my normal recommendation. I usually say I call 2 weeks that grocery store time, where maybe, you can put a little makeup on. And again, another example how everybody's different. But you still have some bruising and swelling at 2 weeks, no doubt. And like you said, during that 3rd week is when you felt like you could get back out. And I always tell people no exercise for 2 weeks.
Right. The one thing that I found, I normally wear my hair up, but I couldn't do that. And other than that.
What about now? Are you wearing your hair up yet now?
I
or
do.
Not quite yet.
Not as often as I would like to. However, just extremely bad hair days, I will wear it up.
Okay. Why don't you just go ahead and tell us, broadly speaking, overall, how did you feel? How'd we do? How did our office do in terms of before, during, after, and how you feel at this stage about the process having had done this?
Okay, for one thing, I'm pleasantly surprised at the support afterwards. It was more than what I thought.
Okay.
which is good.
Yeah.
I'm
can't
just
check
not,
on someone too much.
right. I'm not used to that level of care.
No.
Here, it has been wonderful. I do not regret having this done at all.
Awesome.
Like I said before, no buyer's remorse.
Right on. Okay. What about some of the changes? What are some of the, like, you look in the mirror and you're like, oh, wow, that looks different.
One thing that I'm very pleased about is I don't have the jowls like I did. I mean,
Good.
little,
Yeah.
I mean, I still have some little fatty patches, but nothing like I had. So that's good. I feel
Exciting.
so much more refreshed. It's like
Good.
it matches more how I feel inside.
Perfect.
That's what I love about it.
Right on. Exactly. That's great. Yeah, one of the things we oftentimes say, or I like to say, is we want people to look more like they feel. So, people that, they're exercising all the time, they feel great, they don't have any bad joints, they just feel a lot younger than they think they look. We want you to be able to look as young as you feel.